Good morning. My name is Patrice Burnett, and I'm the current Vice President for the St. Louis Nurses in Advanced Practice. Just want to shout out to all my colleagues out there and say Happy Nurse Practitioner Week. Today, our topic is going to be COVID-19 treatment. Now, if you're concerned that you may have COVID, there are multiple online tools that you can use to determine if you need to seek testing or seek medical care. There are assessments available on the CDC website at mayoclinic.org. And if you're a patient of BJC, SSM, or Mercy, and you have a MyChart account, there is a self-evaluation you can fill out and then be linked to a physician or nurse practitioner if needed. A majority of patients can remain at home and may use either Tylenol or ibuprofen for fever. Hydrate and be sure to receive adequate nutrition. Be sure to rest as much as possible. The World Health Organization and the CDC recommend the ill person to remain isolated in the home, their own bedroom and bathroom if possible, and away from family members. Be sure to disinfect surfaces and in common areas for everyone to mask. Isolation should continue for about 10 days after symptom onset and 3 days without a fever, while asymptomatic patients should stay in isolation for 10 days after a positive result. But if you develop worsening lightheadedness, difficulty breathing, chest pain, or dehydration, you really do need to seek care. Parents should watch children for difficulty breathing, fast or shallow breathing, blue lips or face, confusion, difficulty waking up, or not keeping down liquids. And contacts should remain in quarantine at home and monitor for symptoms for about 14 days after the last contact with the isolated person. Cough can be treated with over-the-counter cough medicine or a medicine prescribed by a provider. And at this time, although some observational and unpublished reports have shown hydroxychloroquine to have a clinical benefit, the current evidence shows that it has no proven role for COVID-19 treatment. Monoclonal antibodies are being evaluated for mild to moderate disease, and early trials suggest a potential benefit there, but these are not available to the general public at this time. Most COVID-19 specific therapies, including dexamethasone, remdesivir, and other antibody-based therapies, are being used and evaluated, but generally only on hospitalized patients. So again, if you're concerned you may have COVID, start with the online self-assessments that I mentioned earlier, and you can go to those assessments and find out kind of which path to take. Thanks for watching, and look for our next video tomorrow.